Welcome to the Radical Libertarian, where each episode is a journey toward unveiling the obscured truth about liberty, free from the conventional narratives that dominate our world today. I'm your host, Jason Feimster, and this is episode number 10, titled The Drug War: Time for a Libertarian Solution. Today we dive deep into a topic that has shaped millions of lives, influenced our economy, and altered the fabric of society itself: the war on drugs. We'll explore how decades of aggressive policies have not only failed to curb drug use, but have also led to devastating consequences for individuals and communities alike. Join me as we scrutinize these policies through a libertarian lens, advocating for a radical shift towards freedom, responsibility, and respect for individual choice. Stay with us as we dissect, discuss, and discover libertarian solutions to one of the most persistent problems of our time. As we delve into the historical context of the drug war, it's crucial to understand the origins and the pivotal moments that have sculpted this relentless battle against substances deemed illegal by governmental decree. Today's episode will guide you through the intricate past of drug regulation in the United States, a journey marked by fervent intentions and unintended consequences. The saga begins in the early 20th century, a period ripe with reform and the burgeoning belief that government could shape a moral society. One of the earliest federal responses to drug use was the Harrison Narcotics Tax Act of 1914, initially intended to regulate and control the production and distribution of opiates and cocoa products through a system of taxation. The act inadvertently laid the groundwork for criminalizing drug possession and use. This was a critical pivot from the regulation to prohibition, setting a precedent for future drug laws. As the decades progressed, the landscape of America's drug policy was further shaped by societal attitudes towards different substances and the people who used them. The 1970 Controlled Substance Act marked a significant escalation, introducing a tiered schedule of drugs and stiff penalties for their distribution and possession. The act became the cornerstone of the modern drug war under President Richard Nixon, who officially declared a war on drugs in 1971. Nixon's initiative was not merely a campaign against illegal drugs, but a politically charged weapon against dissent and disruption, disproportionately affecting African American communities and amplifying racial inequalities within the legal system. The socioeconomic impacts of these early drug laws were profound and far-reaching. Communities were torn apart as incarceration rates soared, particularly for non-violent drug offenses. The ripple effects were seen in the destabilization of families, economic decline in already vulnerable areas, and a cyclic trap of poverty and crime that has persisted across generations. The war on drugs has not only been a war on substances, but, crucially, a war on people, on their freedom, their future, and their right to choose. Today, as we look back at the origins and the evolution of the drug war, it is clear that the consequences have been severe and the effectiveness questionable. As we continue our discussion, remember that understanding our past is imperative in reshaping our future, a future where liberty and justice do not fall victim to the war on drugs. As we turn our gaze to the present, the drug war remains a stark and troubling reality. Its shadow looms large over our society, inflicting deep scars that beg for our attention and action. Today we'll examine the contemporary landscape of the drug war, armed with statistics and a demand for justice. Let's consider the staggering numbers that define this ongoing battle. In the United States alone, nearly 500,000 people are incarcerated for drug offenses at any given time, making up about 20% of the incarcerated population. These are not mere numbers. They are fathers, mothers, sons, and daughters, people whose lives are forever altered by what many consider to be a flawed policy. The radical disparities in drug-related arrest and sentencing can only be described as profound. Despite similar rates of drug use, African Americans are almost 4 times more likely to be arrested for drug offenses than their white counterparts. This disparity doesn't just highlight a bias in enforcement, it illustrates a systemic failure that perpetuates cycles of poverty, exclusion, and despair in communities of color. The economic toll of the drug war is equally daunting. The United States spends over $47 billion annually on the drug war. These funds could be directed towards education, healthcare, or infrastructure, sectors that uplift society rather than tearing it down. The cost isn't just monetary, it's measured in human potential wasted in prisons, in futures derailed, and in trust eroded between communities and those sworn to protect them. In the face of these harsh realities, it's crucial to confront the heart of the issue. The drug war, as it stands, is not merely a battle against illegal substances. It's a war against personal freedom and economic rationality. The impact of this war on individual lives and on society at large begs for a reevaluation, for a new approach that respects individual choice and promotes harm reduction. As we delve deeper into this topic, remember that behind every statistic, there is a human story, a story of loss, struggle, and often injustice. Our commitment to liberty and justice demands that we look these realities in the eye and ask ourselves, is this the best we can do? Is this the society we aspire to be? In this segment, we pivot to a libertarian critique of the current drug policies, a perspective that champions personal freedom and scrutinizes government intervention. As libertarians, we assert that individuals have the right to make decisions about their own bodies and lives, provided they do not infringe upon the rights of others. Today's discussion exposes the fundamental flaws in the drug war and lays out a vision for a more just and free society. The libertarian view begins with a fundamental question. Why should the government have the authority to dictate personal choice, especially when such choices do not harm others? The war on drugs, at its core, is a significant overreach of government power, intruding into the private lives of individuals. It's not just an infringement on personal liberty, it's a misallocation of resources that could otherwise be used to empower and uplift communities through education and rehabilitation rather than punishment. One of the central pillars of libertarian philosophy is the harm principle, which suggests that the only purpose for which power can be rightly exercised over any member of a civilized community against his will is to prevent harm to others. Drug laws, however, often punish the user, who is harming no one but potentially themselves, more harshly than crimes that directly harm others. This approach is not only inconsistent with libertarian principles, but has proven ineffective at reducing drug use or making society safer. Furthermore, the economic inefficiency of the drug war cannot be overstated. The billions spent on incarcerating nonviolent drug offenders dwarf the expenses that would be required for treatment and prevention programs that could actually mitigate harm. From a fiscal standpoint, the drug war represents a colossal waste of taxpayers' money, funds that are poured into a system that breeds recidivism rather than recovery. Another aspect often overlooked is the black market that prohibition inevitably creates. By making drugs illegal, the government inadvertently fuels a dangerous underground economy. This market is unregulated, untaxed, and contributes to a cycle of violence and corruption that affects countless innocent lives, both here and abroad. A libertarian approach advocates for the decriminalization and regulation of drugs, which would cut off the lifeblood of the drug cartels, reduce crime, and generate revenue through taxation. In conclusion, the libertarian critique of the drug war calls for a reevaluation of our approach to drug policy. It invites us to consider a world where personal freedoms are respected, where government intervention is minimized, and where resources are allocated not to wage war on our own people, but to offer paths to education and recovery. As we contemplate these ideas, let us consider not just the practical benefits of such a shift, but the moral imperatives that compel us to seek justice and liberty for all. As we broaden our horizon beyond the shores of the United States, it becomes clear that alternative approaches to drug policy can offer valuable lessons. Around the globe, some nations have chosen paths divergent from harsh prohibitions, embracing strategies that focus on harm reduction, public health, and human dignity. Today, we will explore how these countries have reformed their drug policies and the profound impacts these changes have brought. Let's start with Portugal, a pioneer in radical drug policy reform. In 2001, Portugal took a bold step by decriminalizing all drugs, a move rooted in compassion and pragmatism. Instead of arresting those caught with drugs for personal use, they are now referred to a dissuasion commission, focusing on treatment and recovery rather than punishment. The results? A dramatic reduction in drug related deaths, HIV infections, and drug related crime. Portugal's model shows us that decriminalization, coupled with strong support systems for addiction treatment, can lead to healthier societies and less strained judicial systems. Switzerland offers another compelling example. Faced with severe heroin crisis in the 1990s, the Swiss government implemented a revolutionary program that prescribed heroin to heavy users under strict medical supervision. This approach not only reduced crime rates but also improved the health outcomes and social integration of drug users. The Swiss experience underscores the potential benefits of treating drug addiction as a public health issue rather than a criminal one. These examples illuminate the stark contrast between punitive measures and those that prioritize human health and safety. They challenge the narrative that criminalization is the only way to address drug problems in society. Instead, they present a vision of what could be possible when policies are shaped by empathy and grounded in evidence. The lessons from Portugal and Switzerland are clear. When we shift our focus from punishment to prevention and treatment, from exclusion to inclusion, we not only save lives but also foster a more just and stable society. This approach aligns with the libertarian values of individual freedom and minimal government intervention, offering a blueprint for how we might rethink our own drug policies. As we consider these global perspectives, let us be inspired by the possibilities they present. They invite us to imagine a world where drug policies are not dictated by fear and punishment, but by understanding and compassion. A world where policies are designed not to wage war against our own people, but to support them in overcoming challenges and leading fulfilling lives. As we envision a new path forward in the realm of drug policy, it is essential to articulate specific libertarian solutions that promise not only to alleviate the burdens of the current drug war, but also to enhance freedom and dignity for all individuals. These solutions emphasize the core libertarian values of personal responsibility, minimal government intervention, and the protection of individual rights. Let's delve into these proposals and explore the manifold benefits they hold for society. First and foremost, libertarians advocate for the complete decriminalization of drug possession for personal use. By removing the criminal penalties associated with drug use, we can significantly reduce the number of people incarcerated for non-violent offenses, thereby alleviating the immense financial and human costs of imprisonment. This shift would not only restore personal freedoms, but also redirect resources from enforcement and incarceration towards more effective avenues such as addiction treatment and preventative education. Moreover, adopting a policy of regulated legalization can address the dangers posed by the unregulated black market. By establishing controlled environments for drug sale and use, the government can ensure safety standards, diminish the power of drug cartels, and reduce the violence associated with drug trafficking. Tax revenues generated from regulated drug sales could be reinvested into public health initiatives, further enhancing community welfare and safety. Another key aspect of libertarian solutions is the emphasis on harm reduction strategies. Unlike punitive approaches that seek to punish users, harm reduction acknowledges the reality of drug use and aims to minimize its adverse health and social consequences. Programs like needle exchange and safe consumption spaces not only save lives by preventing overdose and the spread of infectious diseases, but also offer pathways to treatment and social services, respecting individual dignity and promoting recovery. The benefits of these libertarian approaches are profound and multifaceted. Societally, they, they promote a more humane and just system, reducing the stigma around drug use and allowing individuals struggling with addiction to seek help without fear of legal repercussions. Economically, they offer significant savings on enforcement and incarceration costs, with additional revenues from taxes that can be used to bolster public services. From a public health perspective, they prioritize the well being and safety of communities, tackling the root causes of addiction rather than merely its symptoms. In embracing these solutions, we are called not only to change policy, but to transform our perspective on drug use and addiction. This is not merely a policy shift, it is a cultural shift towards greater empathy, understanding, and respect for individual liberty. It's a commitment to building a society that values freedom over restriction, health over punishment, and compassion over indifference. As we draw today's discussion to a close, I want to take a moment to reflect on the journey we've embarked upon in this episode. We've traversed the harsh landscapes of the drug war, explored international waters for lessons on alternative approaches, and envisioned a future shaped by libertarian principles, a future where freedom and compassion guide our policies. The drug war, as we've seen, is more than a policy issue. It's a profound moral challenge that tests our commitment to liberty and justice. It's about real people, real lives, and the real consequences of our choices as a society. As libertarians, we hold the belief that every individual possesses the inherent right to make choices about their own lives, as long as they do not harm others. It is a simple yet powerful principle that should guide our approach to drug policy and beyond. Our discussion today is not just an academic exercise. It is a call to action. It is an invitation to reimagine how society interacts with the vulnerable, how law interprets freedom, and how policy can be a tool not of oppression, but of upliftment. As we stand at this crossroads, let us choose the path that leads to a more compassionate, just, and free society. I encourage you, the listener, to ponder these ideas, to question the status quo, and to engage in this crucial conversation. The war on drugs is not just fought in the hills and the halls of Congress or on the streets. It's fought in the hearts and minds of every one of us. Every step towards reform starts with a change in perspective, with one voice advocating for liberty and justice. Thank you for joining me on this episode of The Radical Libertarian. If you found today's discussion enlightening, don't hesitate to share it with others who might also appreciate our deep dive into the essence of liberty. Remember, you can revisit this and other episodes on Spotify, YouTube, and our website. Follow us on Instagram and Facebook to stay updated and engaged with our community of free thinkers. Until next time, keep questioning, keep fighting for freedom, and remember, the pursuit of liberty is the pursuit of happiness.